Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then in the thionamides, the next is thionamides uses. Thionamides are used as drug of choice for they are used as drug of choice for Graves' disease, then nodular goiter. They are also drug of choice for drug induced hyperthyroidism, and they are also used to make the patient hypothyroid before the surgery. It is important that the patient is hypothyroid before the surgery, or else there is increased risk of thyroid storm. They are also used in thyroid storm. In thyroid storm, actually propyl thiouracil is used. They are also used in hyperthyroidism in pregnancy. So in hyperthyroidism in pregnancy, the propyl thiouracil is used for hyperthyroidism in pregnancy. But the main drawback of these thionamides are the drawback is these drugs. These thionamides will have they will all take almost 1 to 4 weeks to become active, to become clinically effective. They take around 1 to 4 weeks. Then therefore you give so actually these are so first we will start the treatment with beta blockers, which will actually reduce the latency of onset of clinical effect. So beta blockers will reduce the latency of onset of clinical effect, so we give beta blockers prior to giving this thionamides. Then side effects of thionamides are the main side effect is these thionamides can result in rashes. Okay, these can cause rashes in the individual, which are these rashes due to thionamide are more common. They can result in angioedema, and they can cause agranulocytosis. Hypothyroidism is more common. Relapse is actually a major problem with thionamides, and we can give courses of iodine 131 is given along with anti-thyroid drugs. Along with anti-thyroid drugs, we give courses of iodine 131 are given mainly to prevent the relapse of the disease. Then this agranulocytosis is actually the most serious side effect of the it is the most serious side effect of anti-thyroid drugs is agranulocytosis, and this agranulocytosis is mainly indicated by sore throat, or it is indicated by fever. So for agranulocytosis, the treatment is to stop the drug.
thank you and thank you for watching.